Hello, everyone. So this is Christine So. I'm the Executive Director of the Global Health Council. I want to thank everyone for joining us today. This webinar will be a discussion around the Global Financing Facility upcoming Investors Group meeting. And we are pleased to have several presenters on today's call. Kadi, Toure, and Maty Dia from PMNCH will be providing an overview of work done around civil society engagement in GFF and what's been going on at the country level. And we have Joanne Carter and Mesfin Teklu, who are the civil society representatives to the investors group, who will be talking about the upcoming meeting. We will have plenty of time for discussion today, and so we hope to receive your comments and questions, and to be able to really have an interactive session. Just some housekeeping. Everyone is muted, and if you are on the telephone, can you make sure that you are muted until you need to speak? If you have a question or comment, please send it in through the chat function or by email to Liz Colway, who is the person who sent out this invitation, so that we can manage the questions and comments that way. We have a lot of people joining on today's call, and so it is not possible to ask people to come in via the audio. So again, if you have comments or questions, please send them in through the chat function. So we will get started. Just to note that this webinar is a continuation of the various conference calls and webinars that have taken place over the last year and a half, I'd say, really trying to provide a space for civil society to be able to keep up with what is going on with the development of the Global Financing Facility. We designed today's call deliberately to just be amongst civil society, so this is really an opportunity for civil society representatives to discuss and also to raise any issues that they feel are critical for the meaningful engagement of civil society in the GFF going forward. And just to note again that Mesfin and Joanne are the civil society representatives to the investors group, which is the oversight group that will be meeting next week. So with that, I am going to turn the microphone over to Kadi, Toure from PMNCH and Maty Dia from PMNCH, and ask them to come in to provide us with an update on civil society engagement and the country process. So Kadi, I believe you all are on the phone, so please join us over the audio. Thank you.
Hi, Christine, can you hear me?
Yes, we can hear you very well.
Perfect. This is Kadi. I'm sitting in the office in Geneva, and so I hope Maty has joined from Dakar. I know she was flying in right before the call. But I will go ahead and provide you with a bit of an update on what we've been discussing to date. A number of partners have followed, I think, the various webinars and teleconferences, so are aware that we've been conducting a process of consultations with civil society to try to identify what their experience with the GFF processes in countries have been so far, and to identify ways in which we could sort of help facilitate their engagement in those processes in countries. And we have received a number of recommendations from civil society around things that can be done, and I think that we can categorize them sort of in three ways. And one was around trying to ensure the systematic inclusion and involvement of civil society in the RMNCH platforms in countries, proposing a minimum standards to be adopted by those country platforms that would try to improve transparency, participation, and accountability. So you might have all seen a draft of those minimum standards that have been proposed, and there are two streams going on around that. One is a sort of global level advocacy to the GFF Secretariat and the investors group around actually formally adopting those and sharing those with countries as part of guidelines that would help shape the work that they do. And then two is working with civil society in countries and sort of enabling them to advocate to the country platforms themselves to adopt these minimum standards and get engaged in that process. Mesfin and Joanne are, I think, best placed to brief on this, but I know I think that there will be some discussion of the minimum standards at the upcoming IG meeting early next week, with a proposal that some of this feedback be included in the guiding document. So I think that's some good news. On the other hand, we are working with Maty Dia and Lola Dare to organize a range of consultations among civil societies in countries to discuss the minimum standards, a proposed advocacy strategy around that, and a proposed broader advocacy strategy around involvement in the GFF processes. If Maty's online, she might be able to brief on a consultation that was held in Senegal that brought together over 35 coalitions and organizations, and that happened 2 days before the multi-stakeholder meeting around the GFF in Senegal that took place on February 5th. Feshade has also led on February 5th a consultation in Cameroon around engagement in the GFF, and we're hoping that between now and the end of March we might be able to stimulate some discussions in all of the GFF countries to enable civil society participation. That's the update that we have until to now. I think some of the information that we've received from the World Bank around processes in countries indicate that in Liberia and Uganda they are advancing around drafting of investment cases, and that the work is quite advanced in Cameroon, though they're still at a sort of analytical phase, and we haven't seen a draft of the investment case there. And that in Ethiopia there's a health sector transformation plan that was launched in late 2015. They also mentioned that the government of Bangladesh was to launch the GFF program in late January, the 24th. We haven't heard as to whether that's happened or not. And we do know that the meeting in Dakar to launch the GFF did happen on the 5th of February. So as we receive additional information, we'll share all of that.
Thank you, Kadi. Yes, is Maty on the line? Maty, are you there? Okay, it sounds like Maty has not joined yet. Kadi, perhaps we could ask you to speak a little bit about some of the discussions that have been going on in the core civil society group just around organizing towards engagement.
Okay, so on the broader recommendations that came out from civil society, so one bit was around defining the minimum standards and supporting civil society engagement in countries. The second recommendation was around strengthening access to information, with a note that even if civil society haven't been engaged, the lack of information or access to information has been one of the impediments to them even organizing themselves and getting to the table. And so some of the requests were that these webinars and teleconferences be organized on a monthly basis, that email communication be shared every time there's an update that's received from the GFF Secretariat or related partners, and that three, there be the development of a civil society focused website that would house resources on the GFF. So the webinars are ongoing, and an email list has also been developed for the GFF. If you do not get regular email updates from us and would like to receive those, please do send me an email, and I will try to add you to that group. Work is also ongoing to set up a civil society focused website that would be in addition to the GFF Secretariat-led website on the GFF. So that work's ongoing. And the third recommendation from civil society was to have a coordinating group that would bring together all of the partners that are currently leading on efforts around the Global Financing Facility. As partners know, the Reproductive Health Supplies Coalition, Global Health Council, a range of different partners have been extremely engaged in supporting GFF-related civil society efforts. So a group is being formed that would bring together all of those partners operating at the global regional level and also leading civil society organizations in countries that are coordinating efforts around civil society engagement in the GFF. And the mandate of that group would really be to try to align efforts and resources around civil society engagement in the GFF.
Great. Thank you, Kadi, for that overview. Why don't we go to Mesfin and Joanne, who can give us their updates, and then we can see if Maty has joined and give her a chance to contribute, and otherwise we can take some questions. So Mesfin and Joanne, over to you.
Okay, Christine, this is Mesfin. Thanks very much. Yeah, thanks, Kadi, as well for that overview in terms of update where we are in terms of since the last call and the meeting that we had in Nairobi. And certainly, we are preparing now for the second investors group meeting, which is going to be happening in London next week, 17 and 18 February. And in preparation for that, the investors group has been working on a number of products in follow-up to the first investors group meeting. So this include, developing a number of products on several issues. One is around financing for PMNCH. So, within the broader facility, it's not only those countries that are receiving the trust fund, but countries that are not currently, the trust fund aimed to reach 63 low and middle income countries with GFF. And there is kind of, a proposal how to mobilize and finance PMNCH in the broader facilities. So there are quite a number of discussion papers as well as a recommendation that has been developed by different working group, the technical working group, and several task teams. So those agenda items will be taken forward, and some of those are for decisions and some of them are for discussion. So in terms of the priorities for the investors group meeting, there will be an update from progress on the countries, the 12 countries. So the Secretariat is compiling country update, and then we'll share with you as those information are made available to us. So the other discussion point which is going to be tabled for the investor group meeting is how the GFF basically be used to finance PMNCH in fragile context and humanitarian settings. So there has been a task team that has been put together to provide a recommendation for the investors group. That discussion, outcome of that discussion will be presented for discussion and clarity and guidance from the investors group for the task team how to take those work forward. And we'll have agenda on private sector engagement. As you all know, that the GFF is aiming to mobilize financial resource for PMNCH, both from the trust fund as well as domestic resource and private sector. So, one of the issues in how to galvanize and engage the private sector in support of the GFF. So there is a proposal for put together, and that will be presented as well. And one major theme, perhaps maybe, which was also mentioned by Kadi, is the communication strategy. I think since the Nairobi meeting in November, there was a strong recommendation for the Secretariat and the investors group to provide, information as well as communicate regularly to countries who are, engaged in the GFF process, and as well as the broader facility countries. So the Secretariat hired a consultant to help put together a strategy. That strategy has been drafted, and with broader consultation of the investors group and other stakeholders, then the strategy will be presented for decision in terms of how the GFF would communicate with the broader stakeholders. So quite a number of product that has been developed by the technical working groups, and it's been coming in preparation for the meeting, and I think some of those documents have been shared, I think, last week with this group, and would be happy to hear from all of you if you have any comment or any thought that we should take, take into consideration or take forward in our role. We'd be happy to hear. Perhaps maybe you can send by email, whichever way is appropriate for you to send feedback. So, Joanne and I will also be looking at, in terms of our role for advocacy and inclusion of the minimum standard in the country guidance document. We have had several discussions with the Secretariat in terms of how to take the civil society recommended minimum standard to be part of the GFF guidance, or even for proper adoption and support their utilization at the country level. So there will be a session on the country platform as well as the quality assurance issues, and we will use those opportunities to advocate and raise the profile of the minimum standard and formally request for formal, inclusion of those minimum standards as part of the country guidance document. And we, so far, the discussions that we have had with the Secretariat has been very positive, and I think we need to continue advocate, for stronger inclusion of those documents in the country guidance, and certainly, the minimum standard would give us a better leverage in terms of engagement at the country platform process. So, those are one of the priority for us, as you participate in this meeting next week. But again, there are background documents that has been prepared along these different agenda items, and we will share, whichever document is coming along our way as a pre-read. Then any of you who have time, as well as any reflection on those documents, would be interested to hear your views. So that would be very helpful. So I think I should stop there and ask Joanne if you have anything to add, or perhaps maybe supplement on what I've already said. Thank you.
Thanks, Kadi and Mesfin. Sorry, thanks, Kadi and Mesfin. That was great. I would just add, maybe starting from the last point that you made, Mesfin. Yeah, we have gotten, in terms of the investors group meeting, we have gotten confirmation that the minimum standards and our interest in bringing those forward has been shared with the chair of the investors group, and that we will be given time during that country platform session to present the findings and the content of that. And again, I think with the goal that the minimum standards that civil society has developed would be incorporated into the country guidance, which would be essentially what would be the interface with countries about what's sort of expected in the context of the GFF and for country operations. One other thing I just wanted to mention myself is that my own organization has commissioned a kind of review of the experience of partners in the 4 front-runner countries in civil society, and just gathering interviews and understanding folks' experience on engagement with the GFF, what did work, what didn't work,
what partners felt like was needed, and some recommendations, again, based really on the civil society input. So that document will be ready, should be ready in the next day or so as a background document to be made available to civil society, but also for the to inform the investors group discussions, just to get more direct feedback from civil society about that can't all be there, about what the experiences were like in trying to engage with GFF in the 4 front-runner countries, again, based on direct feedback and interviews from folks in country. In terms of the just a few brief comments on key areas in the agenda. One other area that came up was, so there are 12 countries now, so 4 front-runner, 8 sort of second phase countries, but there are 51 additional countries that could be eligible for GFF, and the question has been how to engage with those countries with a real broad spectrum of kind of options, from somehow figuring out how to engage in all of those countries to something that's more focused. And a recommendation that's going to go forward would be to, again, have some communication with all of those countries, but a prioritization of a next steps of engagement with probably a handful of additional countries. The challenge being is that there isn't necessarily GFF trust fund money to be provided for investment in the country's RMNCH investment case, but there might be small amounts of money available for technical support in a handful of countries, and the goal would be, I think, to engage some other partners and donors, and with the trust fund perhaps being able to provide a little bit of technical support in a next set of countries. So that's to be discussed and sort of recommendations given by the investors group, but I think the idea would be to not necessarily go big to every country when we haven't yet really fully developed or the model, and when there isn't necessarily a pathway to significant additional resource mobilization for all of those countries at this point, but to sort of start in a more focused way. So that was sort of one piece that came up. And then on the technical kind of update on the technical guidance issues that were brought up, and I think many of us have discussed previously around country platforms. I think are addressing that through the minimum standards, but there will be discussion around the technical assistance and quality assurance. And just to flag a few issues that have come up, one is, again, questions about whether the quality assurance process, the idea was to make it sort of a country-led process, sort of individually designed, but I think still some questions about, is there some value in having a more standardized kind of quality assurance process, or more of a country-led one? How do we ensure that that's built into every investment case? There is pretty significant focus in terms of technical assistance that be a sort of country-led process. And I think one of the things that was being found is that particularly technical support around the health financing strategies has been a little bit more challenging. And I still think that there is significant room for us as civil society around around technical assistance overall, to really push for a role for civil society as technical assistance providers, both around the investment case, but also key elements of the health financing strategy as well. And I think some real openness to that as well. I'm just trying to see if there were any other kind of key issues to flag. And then there are some fairly, significant proposals around different ways for the private sector to be engaged, including development impact bonds, the potential of taking World Bank loans that are at commercial interest rates, IBRD loans, and building in buy downs of those loans to lower rates, more concessional rates, linked to kind of performance. So I think folks are looking at innovative ways to engage the private sector more broadly, but also engage in some of these specific financing strategies. And I think it'll be really important for civil society to look at that, and I think for us to also continue to look at the making sure that equity is a centerpiece of those, and that relates certainly to sort of private sector investments, but also to, in many ways, performance-based financing, which can be, interesting and useful mechanisms, but unless equity is really central to those, can inadvertently kind of almost move you away from an equity agenda. So I think that will be a real important piece of the discussion as well. And I think the last thing I would just say is, I think many people have raised to me over time just the importance of ensuring that resources that are going to GFF really are additional resources, so that we're not seeing a substitution of donor resources, but also that one of the sort of exciting opportunities of GFF was to crowd in or capture more IDA resources from the countryside, because of the incentives of the GFF, investing more IDA into health and into PMNCH and nutrition. And I think one of the things I think we would also want to push is just really clear tracking of that. So sort of really understanding what are new resources and getting some clarity about, to the extent that those can be disaggregated, how those are going into PMNCH, and so that we can really understand some of what's working about the leverage of GFF, where there really are additional benefits. I'll stop there.
Great.
Yeah, just Joanne. Yeah, Christine, one point to highlight. I think in the agenda we mentioned about a session on country updates. I think we'll have a better understanding of what's going on, and we're hoping that Maty would share what's happening in Cameroon and Senegal. But I think it would be good for colleagues who have joined from the country in this call. I don't know how many people. At some point you let us know, your level of engagement, how you see things are going, then it would help us as well to represent you well. And if there are any issues that are hindering or facilitating your engagement, I think it would be good to learn what's going on at the country level with CSO engagement. And certainly the minimum standard, we highlighted a number of points how civil society should be represented and in the platform, but the reality sometimes might be different from the ideal. So it would be great to hear from our country colleagues, even after this call, just if you could send us a couple of points about your experience, that would enormously help to support each other in our engagement at all levels. Thank you very much.
Thank you, Mesfin. I think you summarized what would be very useful in a very clear way. We should have Maty Dia on the phone now. So Maty, are you there?
Hello?
Yes, hello, we can hear you.
Yes, I'm sorry, I had my phone on mute. I apologize for the noise. I'm at the airport. Hello, can you hear me?
Yes, we can hear you. Please go ahead.
Yes, it was cutting off. If you could just please ask what the question was.
Maty, there was no specific question. We were hoping to hear any updates you might have from what you have been working on, and I think specifically Senegal and Cameroon.
Okay, so I would start with Senegal. On February 3rd last week, I organized a gathering of civil society. There were about 23 organizations, local organizations, including organizations from the decentralized regions. We had about 8 regions which were represented on top of Dakar, and the number of participants were about 30. The meeting went really well. Most of them did not know about GFF, besides one organization which was represented at the Nairobi meeting. So for them, this was quite new, and they appreciated the fact that we introduced this to them before the World Bank held the learning meeting 2 days later on Friday with the Ministry of Health. what I can say was that there was a lot of, there are about 4 RMNT-AH platforms working on advocacy, most of them working on the same issues. So the key issue there was really to get organized, you know, to have something coordinated at the national level so that they could, you know, have some kind of a steering committee. At the end of the day, we were not able to select representatives. What I can say about Senegal is that the country platform is not, has not been formed yet. This was the first meeting on the GFF, even within ministry, within the ministry, not a lot of people know about the GFF process. So this was very new to them. And the ministry has, is calling for a meeting in mid-March to set up the country platform and also to discuss how civil society could get involved. There was a, how do you call it, civil society came with a declaration based on the minimum standards. We were not able to read the whole declaration, but most of what was said was that we were asking for the minimum standards to be adopted. The Ministry of Health was there, so she welcomed this very well. And most of the UN agencies, the donors, the partners, USAID, everyone was there, and they welcomed the participation of civil society. So this was really well received. I used the old minimum standards version because I had received, I think, the night before the latest version, which is going to be translated and shared again with all partners within Senegal. So far, I think this is going to be adopted, but it has not been, there was no negative feedback from the bank or from the ministry. What happened after the meeting was that the civil society representatives went and talked to the Minister of Health to say, this is what we want to do, and we would like to meet you before the meeting on the country platform. And this is going to happen within the next 2 weeks. Regarding Cameroon, there was also a meeting on the same day, actually, with the civil society representatives. However, the investment case in Cameroon had already started back in November. Some of the civil society reps were represented, but there is no national coordination yet at, in Cameroon. And this is the main issue that we're having. There is very little organization and coordination among civil society. So we're trying to get them to get organized and get kind of an action plan and a toolkit which they can share to do some advocacy for the minimum standards, and then to make sure that they are involved in the country platform. Hello?
Great. Yes, thank you so much, Maty. I believe we also have Preeti on the line from IPPF, and she has additional information about Cameroon. Can we unmute Preeti?
Hello, can everyone hear me?
Yes, we can hear you.
Yes, thank you, Christine. Just to add to what Maty was saying about Cameroon, we've had an update from IPPF's member association, CAMNAFAO, in Cameroon, and they similarly mentioned that there had been a meeting last week with the Ministry of Public Health, which had included participation from CSOs. I think they said up to 40 CSOs from across the country to discuss the status of the GFF process. And also to disseminate some of the findings and feedback from the meetings that took place in Kenya, and that UNFPA were also involved in this meeting. They mentioned that next week on the 18th of February there is another meeting that's been organized by the ministry, which will be a first meeting to engage with civil society around the national investment case, and that there'll be an update after this meeting as well. And they seem to imply that there was good participation of civil society on what was emerging as a country platform, and that they had kind of assurances that they would be involved in that process. So I can follow up with them after the meeting next week and potentially talk to Maty as well about sharing some of this information.
Great. Thank you, Preeti, for that update.
Hello?
Yes, please go ahead.
I'm sorry, Christine, hi, I'm sorry, this is Maty. I just wanted to add that a big request from civil society from both Cameroon, those that I spoke with, and Senegal, is that they would like to really see the investment cases and get the experience from the other countries, as this has not been very public. And as soon as we can get some of this information, you know, so that they can base their work on what has been done in the other countries. So this would be really good for us to have and share with the platform.
Thank you, Maty. Yes, I know that there has been work ongoing from the World Bank on a communication strategy. The sharing and availability of the investment cases has been a high priority that was noted in November and has continued to be noted since then. So that is being taken into account in that communication strategy, but that strategy has not been completely rolled out yet. And so we will be happy to provide more updates on, as Kadi mentioned earlier, on the website and various other elements of communications that will help facilitate the availability of investment cases. I also know that I'm sure that Joanne and Mesfin will be happy to bring that observation back to the investors group and to the World Bank Secretariat next week. If I could, I would like to go to any questions that we may be receiving or observations or comments. And just, here we go. They have just come up on the screen. So we have 6 questions noted here. I will just let you know Kadi had to drop off of the call for another meeting, but we will try to address the question that is directed to her as well. So the questions for those of you who may be on the phone, the first is, can we hear more about the types of civil society organizations invited? Is it a spectrum of local and international NGOs from across the PMNCH platform? Are youth participating? And I assume that refers to the country consultations, so maybe Maty can speak to that. Joanne, how do we receive documents that will be made available to civil society? Joanne, could you please explain a bit further the challenges faced with developing country financing strategy? Is progress being made on the conflict of impact, I think it must be conflict of interest, guidelines for the investors group? Are there implications for civil society organizations? Is there any civil society organization information kit available to send out to our partners? Could you please state again how to be included in the CSO email list? So why don't I go to Joanne and Mesfin to address these questions. I will also note that the operational issues that are mentioned here, for example, getting into the CSO email list and an information kit and those sorts of things, we can also address in follow-up communications that will go out. But Joanne and Mesfin, over to you for your input on these particular questions.
On the issue, this is Joanne, on the issue of challenges faced with on the financing strategies, so a couple of observations that were shared that relate to the technical assistance, quality assurance, and sort of in the work that's been done in country so far were that, so a couple of the challenges. One, that in some cases the investment case and the health financing strategies have not been linked together very well. So in other words, they've been 2 sort of separate pieces of work. I think it was pointed out that often the health financing strategy has also to be developed at country level has taken longer, that there is, in some cases, it hasn't been as easy to get technical assistance for this, particularly at country level, whether that means it's really not there or it just hasn't been as easy to access. So some of those challenges. That it's taken, it's been a longer period of time to develop that, but I think it's trying to make sure that, I think the whole point of this was that you want to link the investment case with the health financing strategy, and that you want to, so that you're actually thinking about what is it going to take to achieve this. I think one other thing I would flag that I've seen in the guidance for investment cases is that countries should be developing the investment case based on available resources. And while I understand that goal, I also think part of the goal of the GFF, if it's going to be successful, has to be supporting country ambition in a smart, strategic way. So I think what they're trying to do is say, don't just come with a national strategy that has, you know, massive amounts of money required and no prioritization. But at the same time, I think it will be important to not have an investment case that's just constrained by the amount of resources currently available. And they do say that, you know, you could make specific requests beyond or include specific elements beyond what's currently available. But I do think as we figure out how to link the programmatic planning with the financing, we have to use that to drive increased investment and not inadvertently create a ceiling on funding. So sorry, it's a bit of a tangent, but I think those have been some of the observations. And there will also be discussions about how this stuff gets tracked. So I think there's a question of the tracking domestic financing, tracking donor flows, and as I raised before, I think it's important to also track whether the GFF and how the GFF is increasing, for example, IDA resources invested in RMNCAH, and if we can really specifically see that data, I think that would be really useful because we can maybe apply it to make sure that's happening in the follow-on countries as well. And we probably should just, in terms of the making documents available, it probably just makes sense to probably be working through both, you know, Global Health Council and PMNCH to make some of those key documents available. They are internal documents for the investors group meetings, but I think historically the way we've done it is if there are a core group of folks that are interested in really reviewing the documents and providing feedback back to us for those documents, that we would be happy to share those. We certainly want to be transparent. It's just we're not at this point necessarily in advance of the investors group meeting posting them on a website or something. Mesfin, is there anything you'd add to that? But let's make sure to follow up with PMNCH and Global Health Council about how we can get some of those key documents to folks that would be willing to give specific feedback.
Yeah, thanks, Joanne. I think there are two aspects, just to add a few points on what Joanne has already outlined in terms of sharing document. One is resources that is needed for civil society participation in the GFF, and so far we have been relying on PMNCH, the Global Health Council, the Reproductive Health Supply Coalition, to share through their platform to stakeholders who have interest as well as, requesting those information. I think some of them are available on those platforms. But there are other documents that are working document developed for the investors group meeting, which so far has been shared with a core group of people who have shown, interest to review and provide feedback. It's around 20-25 people. And just, to recap as well what Kadi mentioned before, that in fact, we had this core group meeting at the back of USAID meeting, last month in Washington, and basically to outline how to structure our country support as well as information sharing with the broader civil society, as well as a core group of people who have time to review and provide feedback. So that strategy is being refined, and some of the process that Kadi outlined in terms of dedicated websites on the PMNCH or other platform, for sharing resources with civil society, those is yet to be worked out. But I think at the moment we are pretty much reliant on email chain as well as, you know, existing platforms through our partners. And on the other side as well is that, you know, continuing those who are not necessarily on this CSO email list. I think that was one question asked at the last bullet point. Could you please state, outline how to be included in the CSO email list? I think if anyone in this call who is not in that email list, we certainly should reach out to Kadi as well as Christine to be included in the email list so that you can be receiving regular updates through that mechanism, which is currently what we have. The other question that I also want to comment is on the conflict of interest guideline. I think this is one agenda item in the investors group meeting for next week. You know, the governance issues, code of ethics policy, and I think the Secretariat is working on some sort of, I think, document on that. It has not been shared so far, so I can't say much as it stands now, but I think when things are shared with us, we'll be happy to share with the group what that conflict of interest is going to look like. And I think, you know, after the investors group meeting, we'll have that information clearly and happy to communicate back to you. I think the other questions are pretty much related to what's already being discussed in terms of the information kit. Again, you know, just to reiterate what I've said, you know, currently sharing what is being developed for the IG meeting, as well as several documents prepared by partners, and as such, you know, we don't have, you know, tailored product that we think, you know, is a key for CSO engagement, but that is something that we have it in our plan with a small coordinating group to develop, you know, a product and set of tools that should be available for civil societies who are engaging with the GFF at the country level. So that is going to be something that will be worked out, but still it's a long way to go. So I should stop there. Thanks.
Great. Thank you both. And just to underline that we have really been trying to think through how it is possible to make information available and to make sure that that information is getting out. As Joanne and Mesfin both mentioned, we do have information available on both the PMNCH and the Global Health Council websites, and we have been trying to get it out to as many networks as possible. This is something that we are hoping that we are going to be able to improve and structure in a more formal way in the coming months, because we know how important it is. Let me just go back to Liz and ask if we have any additional questions or comments that have come in. Oh, lots of them. Okay. So we have a new list that is up on the screen. I will read through them quickly. Following the question on conflict of interest, are there safeguards being put in place to ensure that corporate contributions are not allowed to influence the priorities of country plans or of GFF policies at the global level? This has been a challenge with the Global Fund for at some points with pharma companies. Who is leading the consultations in Kenya? Could you speak to the place of nutrition in the investment cases? Are we seeing coverage of the nutrition-specific interventions in the guidelines for these development cases? Questions regarding tracking funding. Is it via national budgets, and can it be traced or through other channels? Could we hear a bit about any challenges to equity that we are seeing in the early days of the startup countries? We have heard there is a meeting of CSOs in London next Friday hosted by IPPF that is open to all. Could you please circulate details of this? Is it clear at this point which additional countries might be targeted, or the basis on which these would be selected? And finally, how can organizations with health financing, finance tracking, or other TA expertise support countries with these technical areas? I'm going to start by asking Preeti if you are still on the line. Do you have any information or that you can share about a meeting next Friday being hosted by IPPF in London?
Thank you, Christine. Yeah, I was going to mention it on today's call as well. We're just about to circulate details of an event that was, or a meeting that has just been finalised with Bank as of yesterday. So as Monique and colleagues are attending the investors group next week, they had been in conversations about whether we could host a meeting. So that is going to go out to civil society broadly, UK-based and London-based civil society organisations, and it will be taking place at IPPF next Friday from 11 till 12:30, and I'll circulate the details as soon as this call's over to all participants on this call. And that is really to hear an update from the bank, but also to have an informal Q&A. And they're quite happy for it to be open to civil society organisations across the health sector. So that will be shared with you all. Unfortunately, I'm not 100% sure that we can do any facilities for teleconferencing in. I'm going to look into that, but otherwise there will be a note of the meeting shared with different listservs and different groups, so we'll be sure to feed back what was said in the meeting.
Great, Preeti. Thank you for that update. That's great that you're going to have the opportunity to do that kind of a meeting. We've done several of those here in Washington, D.C., but it's good to know that that will take place in London. Please do share any details if it is possible to dial in or connect over the web, and otherwise we will look forward to any notes you will have so that we can circulate them broadly.
Perfect, I will do. And if people do want to send, if the facilities aren't possible and people do want to send specific questions, that's an option as well, but I'll make sure to circulate the details after this call.
Okay, great. Let me now go to Mesfin and Joanne and Maty for anything that you want to contribute around the various questions that we've received. Over to you.
Yeah, thanks, Christine. Maybe let me try, a couple of bullet points, and then I will let Maty and Joanne respond for the rest. I will start from the easier one, the last bullet point. How can organizations with health financing or finance tracking or TA expertise support countries with these technical areas? I think this is one area that the Secretariat welcome in terms of technical support. I think, they are very much interested, actually, civil societies, perhaps maybe seconding or, providing the technical support that organization can provide in these areas. And although the mechanism has not been sorted out, but I think this is one area they are looking at in terms of civil society contribution to the GFF. Whoever put that question in the chat box, I'll be interested to, if you could send us email which organization is that, then we'd be happy to make the connection. But even others who have not thought about this is an area that's being sought after, and it's a welcome news, actually, offer, for the GFF. In terms of the other point, let me say, on the other countries apart from among the 51 countries which are not the focal 12, I am not sure, or that has not been at least, discussed or shared with IG members which countries are being considered, but there is a broader framework that's being developed to reach out or involve many countries as much as possible with GFF and who are not necessarily receiving the trust fund. So perhaps, Joanne might have some comment on that. I think this is yet still being discussed within the technical working group, which is not yet shared with a broader investors group. So I don't have much information on that. I think the other issue around, nutrition, I guess, that's a valid question. And so far, the investment case that we have received is a Kenya one. And perhaps, many of you also may have heard Tanzania was also one country that had received, funding for their PMNCH strategy, which actually include resource from the trust fund, as well as donor bilateral money, I believe from USAID, and as well as from the Power of Nutrition, which was to finance the investment case. So I think nutrition is being considered in the Tanzania case, but other investment case, it has not been finalized, or we have not seen it either. And the Kenya one, I don't exactly remember whether it is actually comprehensive enough to address the nutrition specific intervention. So I think the investment case is available, and folks can see that whether that is actually adequately represented. So the other points, I think I will just stop there. Maybe I'll let others to comment on the rest of the point. Thank you.
Hi, this is Maty. I just wanted to add a bit on the, there was a question about how we select civil society organizations within the platform in the countries. It's really, really wide, and one of the key criteria is that we are representative. I mean, we have people working on neonatal health, we have people working on family planning. There's a big family planning constituency in Senegal, for example. And I made sure that there were 2 representatives, actually 3 organizations with 6 representatives from the youth coalitions in the different regions of Senegal. And in Cameroon, we're also making sure that youth is represented on the platform. The selection is really wide, and it's really we make sure that we take the whole RMNT-AH continuum, and youth is a priority. So that's the response on one of the questions. The other question was about the information that is made available. On top of what the World Bank is preparing, we are PMNCH and CHESTRAD is actually CHESTRAD working on a set of toolkits for to be shared in countries about what the GFF is, how to strengthen civil society engagement, just something really short that is going to be shared with different members in the different platforms. There's a big ask of civil society to get funding from the bank. This was a direct question last Friday, to get funding to set up, convening space, and then to have ways to engage and to develop toolkits that are contextualized in the national setting. The response from the World Bank was quite straight, and I also made sure that, I shared the information that we were trying to figure out ways with different partners to secure some funding, but that more funding would come from the World Bank. And this is a question that I'm getting quite a lot. So I think that's what I wanted to add on the questions that were asked.
This is Joanne. A couple of things I would say just on the question of additional countries not currently part of the first 12. There has been no decision, as far as I know, on which countries would be next, and really what's being brought to the investors group is really guidance on, they want a response kind of from the investors group and kind of advice, guidance on whether this idea of focusing on a next smaller set of countries is something that the investors group supports. So I think that would be the next step. And then I think the idea would be countries where either, my assumption is countries where either internally and externally there is a commitment to some additional resources, might be ones that would sort of get a higher priority. I mean, I think there would be some engagement with countries and probably also some view to with countries with highest need, highest burden, but I think also really looking at where there is either domestically and or externally from some partners ability to potentially mobilize some additional resources, but to be determined, and definitely can feedback after the investors group meeting about that. On the nutrition issue, I am very committed to asking that question since we haven't seen many of the investment cases yet, but to really be asking how nutrition, and if it is indeed central to the investment cases that are being developed and if there's any guidance on that. I do know in Kenya also that, just knowing partners on the ground, that it was because in many cases, like the work that's been done by the Reproductive Health Supplies Coalition, it was in the case in Kenya with nutrition, it was because civil society was there and kind of a bit around the table and able to push on that a bit, that at least there are some nutrition elements in there. So I think it's another lesson about the importance of civil society engagement in these country platform processes to make sure that some of these pieces are included. Again, I'm going to ask the question more about the equity issues, again, because we haven't seen in detail many of the investment cases. I do know regarding equity that in many of the country discussions that we heard when we were in Kenya in November, when countries are being asked to look at highest impact and prioritization, some of how that happens is looking at where the biggest burdens of disease and death are, and often that leads to sort of either looking geographically or otherwise at how do you reach some of the poorest and most marginalized communities. So I think part of that equity is part of developing a stronger investment case, but I would say at this point those equity issues are not necessarily operationalized. I also think there's been acknowledgement about the out-of-pocket costs for, and particularly the impact on folks that are in the poorest 20 and 40% of out-of-pocket health costs. It's not clear. I think we just haven't really seen the health financing strategies yet to understand how that's being systematically addressed. So I think acknowledgement of the problem, not necessarily clear yet on the solution, but I think we're happy to raise those questions. And then again, on the question of conflict of interest, I raised the equity issue as well with regards to private sector and even other kinds of pay-for-performance strategies. But I think it's a very valid point, and we can certainly look at it with regards to the conflict of interest policy as it's drafted, and also in the discussions around private sector engagement. And very much appreciate the comment, and I think we'll be happy to raise those issues in the discussion. I think I caught, just on the health, again, I think we can come back with a report afterwards about sort of some of the ways that are being proposed around tracking the funding. I think they're looking at both what it will take to sort of track these things nationally, but there also has been a kind of look at some of the challenges of attempting to track some of these financing flows globally as well. So I would say I think there's a look at both of these things, and like I said, I also think there's a value in specifically looking at trying to understand through some of these financing flows what the GFF has specifically leveraged and where additional resources have been brought in through that process.
Great, thank you very much. I have received a message in the chat box, and I'm not sure who this is from, but it says, in response to the Kenya question, HENNET, H-E-N-N-E-T, is the key NGO network coordinating civil society engagement, together with FCI and AFP JAPIGA. So I wanted to share that with everyone. Liz, let me go back to you and see if there are any additional questions.
No, there are no additional questions at this time.
Okay, great. Then let me just take 1 minute to wait and see if anyone has additional questions or comments that they would like to send in. Please do so now. Okay, it looks like we have covered everything for right now. I'm going to ask for any final comments from our speakers, but before I do that, I wanted to thank everybody for participating in today's webinar. We will continue to hold these on a regular basis so that the community can know how things are progressing. I think that we are hoping that around investors group meetings we will have the opportunity to have these sorts of interactions before the investors group meeting and then following the investors group meeting. And so please be on the lookout for an announcement for a next webinar, probably to take place in March. And we will also hope to include the World Bank on that call to be able to hear from them about their takeaways from the investors group as well. And so I think we have noted the different points that were made today, especially around operational issues that we want to take forward. We have been taking minutes of this meeting, and so we will be distributing notes widely for those who may not have been able to be on the call or on all of the call. And so those will be going out to the participant list and also available for further distribution. So with that, let me just go back and ask Maty, do you have any final words for the group?
Not if there are any questions. I mean, I'm following up on different countries, and I will be sharing updates. I think it will be ready for the next call, but I have been getting a lot of requests from civil society in Cameroon and Senegal, as well as DRC. One participant from DRC told me that the language issue was a problem, and we should think about holding a webinar like this, just at least share information on the GFF within the next month or so. And I think this is something we can discuss with you, Kadi, and PMNCH.
Yes, thank you, Maty. Yes, just to underline that point, GHC will follow up with Maty and Kadi, and we can see about holding a Francophone webinar in the next month. That is something that we have discussed in the past, and we have the capacity to do that, so we will get that scheduled. Thank you for reminding us about that. That's very important. Okay, and Mesfin and Joanne, do you have some last comments for us?
I would say just that we really, the questions were really useful on the points, and so I think other issues that folks want flagged, if they can send them to us, that would be great. The meeting is next Wednesday and Thursday, the investors group meeting, so we have a bit of time. So either sort of specific feedback or just questions or issues that folks want flagged, because it will be a 2-day retreat, so it's also an opportunity to raise an array of issues like equity, like conflict of interest, like nutrition, like any other pieces. So just really find that extremely valuable, and would just welcome and encourage further feedback.
Yeah, I just want to add again on what Joanne has already said in terms of the input from this group. I also want to thank, so far the engagement with everyone involved, and I think, our representation in the investor group is as effective as the information we get from the countries. So I would really encourage those colleagues who have, first-hand experience at the country level in terms of their participation in the country platform, as well as the development of the investment case and financing strategy. Your feedback would be really helpful, so that our representation would be more effective, and it would inform the process. And I also want to say that the GFF, as countries are developing their investment case, many of the guidelines and supporting documents are being developed. So it is kind of something which is going simultaneously. And I think the bank said learning by doing, but I think which has its own advantage and as well as its own drawback. and a real-time experience from countries really very helpful in terms of the CSOs, what they are facing in terms of opportunities as well as challenge. And at the same time, some of the points that's raised here today as well, what civil societies can contribute in terms of technical assistance, monitoring equity, financial flows, all those really helpful, for us to take forward as contribution, and while also we are advocating for meaningful and effective engagement of stakeholders, especially civil societies at the country level. So we look forward to working with the coordinating group who is, looking at how to communicate better, how to share resources, and I think those are the opportunities that we like to capitalize on, and we really, encourage to a two-way communication from global as well as country and regional colleagues, so that we can support each other without necessarily waiting for a scheduled call. So thanks very much once again, and we look forward to the debriefing after the investor cruise meeting.
Great. So thank you very much to all of our speakers, and thank you to everyone who participated on today's webinar. We will let you go a few minutes early so everyone gets 15 minutes of their lives back. And we will follow up on all the points that have been raised. You can see here if you have questions, please send them to the email address on the presentation that you see. We will be circulating the minutes of this meeting, and we will be following up with scheduling for a debriefing sometime in March, and also a Francophone webinar around GFF, including a debriefing from the IG meeting also in March. And just to remind everyone that if you are in London, there will be a GFF meeting, civil society with the World Bank on Friday, and Preethi and IPPF will be circulating more information about that very shortly. So thank you all, and have a good rest of your day or evening, depending on your time zone, and we will look forward to connecting with you again soon. Thank you. Bye-bye.